My name's Kyle Hassel, and we're going to do the Category 3 SOT video. First, we're going to start off with a prone leg shake. Can you resist against my hands? Okay. And it looks like his left leg is the short leg. Next, we're going to go to the psoas. Can I get you to flip over for me onto your back? And extend your arms back. I'm going to make sure that he doesn't have any bracelets or watches on his wrists. And touch your fingers together. Okay. Looks like his right psoas is shorter. So we're going to come over here. Lift your leg up. Okay. And going to. Okay. And I'm going to bring it out laterally, and you're going to inhale and exhale. Go down and strip the psoas and bring the knee medially. And we'll do that 3 times. And then we'll recheck. And making sure that his hands are even. Next we'll go to the glute fiber analysis. So can I get you to flip back over? And I'm going to start at his PSIS, which will be L5, and move each of my thumbs laterally along the iliac crest for L4, L3, L2, L1, and you can go to T11 if you want to, and then it'll be correspond, whichever one is the most tender, it'll correspond to the according lumbar or thoracic vertebrae. From there we're going to go to the indicators. So we will, if his sciatica is on the left leg, we'll go to the calf, and then hamstring, and then glute, and I'll get the patient to turn left, and the temporal sphenoid line, which is on his zygomatic arch, and those should be tender. And after blocking, I will recheck to make sure they've gotten better. From here, alright, next we're going to do the step out, toe out, and I'm going to bring his leg out, bracing the leg, or holding the leg, and I'm going to look for gluteal bunching, and then I will rotate his foot outward, and I will, if it gets better, that's going to be a piriformis problem. If it gets worse, it's going to be a fragmented disc, and if it's the same pain, that's going to be a herniation or a lumbar subluxation. From here, we're going to go to blocking. It's going to be passive. So our goal is to decrease the pain. I'm going to do, on the short leg, it's going to be on the trochanter. And on the long leg, it's going to be on the ASIS. And this can be done for 30 minutes. After 1 minute, I'm going to make sure that it's getting better, and the pain should be decreasing. If it's not, then I can rotate the blocks 5 to 10 degrees downward on each side, and that should decrease the pain as well. From here, we're going to do the posterior iliofemoral ligament check, augmentation, and I'm going to rotate the feet outwards and see which one is more restricted, and that's going to be his right side. So I'm going to go to the lateral portion around his trochanter, and I will remove the block, and I will get just posterior to his trochanter, and I will do a thumb flick. And that'll be lateral to medial. Alright, next we're going to do lumbar vertebral derotation. I'm going to bring the patient's, I'm going to flex the patient's knee. I'm going to look for tender spinuses. And if I find a tender spinous, I'm going to press lateral to medial on the associated segment. And then next we're going to do acetabular goading. So I'll feel around the acetabulum for tender spots, and I'll put pressure on the associated tender spot or trigger point until it relieves itself. Okay. Then we're going to do orthopedic block. So orthopedic blocking, I will remove the block on the side of spinous rotation, and so the segment will rotate back. It'll fix itself whenever I remove the block, and we will replace the bone. Next we're going to do sciatic traction. So I will have the patient grab the head of the table, and I will traction for about 5 to 10 seconds, and making sure that it decreases pain. And next we're going to do lumbar inferiority lift. So I'll flex the leg of the sciatica. I will look for rotation, and I will put pressure on the TVP. And from there we can do assisted sciatic traction. And I'll get my assistant to traction the sciatic leg, which is his left, and I will put pressure on the associated spinous process, I to S. Alright, next we're going to do sacral base. So I will go to the level of L5, and I'll ask the patient to forcefully cough. Alright, if my thumb goes upward like it did, that'll be a sacral base positive. If it goes towards the head, it'll be a sacral base negative. And if it goes a combination of both, that'll be a sacral base neutral. For sacral base positive, I will block, I will do a smiley face at the ASIS, facing downward obliquely on both sides. If it's a sacral base negative, I will do a frown face at the trochanters, facing superior obliquely. And if it's a sacral base neutral, I will go in between the ASIS and the trochanter, and it'll be a straight line. For correction, I'll go for sacral base positive. I will put pressure on the apex as the patient inhales. And for sacral base negative, I will put pressure on the base as the patient exhales. And then for sacral base neutral, I will do a combination of both. I will put pressure on the apex as the patient inhales, and pressure on the base as the patient exhales, for about three times each. Next we're going to do post-blocking technique. So can I get you to sit up, please? I'm going to go to the lumbar segment of the disc lesion, and I'll mark it. And I'm going to get the patient to flex their head forward and they're going to stay flexed, and as they inhale they're going to flex their trunk downward and pushing their spinous process back towards me, and I'm going to put pressure I to S, and as they come back, keeping their head down, I'm going to push pressure P to A. Continually doing that to relieve pressure off the disc, and come back. Alright, and then another post-blocking technique is go to side posture. So I'm going to go to their sciatic leg down, so that's going to be his left leg. And I can do this, I can do a kick or a push or pull. And I'll go to the side of the rotation away, and I will put pressure P to A if it's a rotation, or I to S if it's inferior.